Welcome back to Better Arizona, everyone. I'm Sarah Karlstrom. Do you ever suffer from migraines or back pain or neck pain? I guess a lot of us do in some way or another. We're talking about chronic pain today, and we're out at AZ Pain Centers. I'm joined by Dr. Croake-Uleman. A lot of people, again, back pain, neck pain, migraines. It affects a lot of people.
Absolutely. We see people come in here with all types of pain, and it's chronic pain. It's debilitating for a lot of people, to the point where they can't do their job like they'd like to. They can't take care of their kids. So we'll see people come in with fibromyalgia, low back pain, headaches of any type, even leg pain that often stems from the low back. Those are some of the things we'll see here that we're able to treat.
And let's talk a little bit about fibromyalgia because it's often misunderstood. Right. Explain to us what exactly that is.
It's widespread musculoskeletal pain that also includes fatigue, and then you'll have tender trigger points throughout the body. And it's with our treatments, what we're doing is we're going to the nerve source to take care of that. And then we can also go to those trigger points if we need to. But it helps to calm down all of that irritation that's going on.
Even though these are all different problems, they get kind of the same treatment. Doctors are prescribing. What are they prescribing? You tell me.
Well, they're often prescribing, you can start with something as simple as ibuprofen. A lot of times people will use that over the counter. Ibuprofen will leave the non-steroidal anti-inflammatories. But problems with those are you can get, ulcers in the stomach, inflammation in the stomach. You can have problems with your kidneys. You don't want to take those long term. And then they'll go to the doctor if those aren't working, and could get anything from narcotics to steroids. The narcotics, of course, you worry about, addiction with those, among other things. And the steroids can cause multiple problems from bone loss to adrenal suppression, problems with the endocrine system and the hormones.
What's going on that's different here? What would you do for me?
Okay, what we're doing here is we're doing injections. And in the injections, we have medications in there that are more holistic, that are not causing problems with the endocrine system, with bone loss. They're not causing side effects. And what they do, they go to the source of the problem. They decrease the inflammation that's going on in there. They help to break down the fibers and the scar tissue that's in there. And they help to reset the cells so they're not sending this pain signal. So it's breaking the pain cycle. And that's often one of the biggest things you need to do, is get that pain signal stopped.
And that's what happens. So, you're blocking it.
Right.
And it's non-steroidal, which means no steroids involved.
No steroids at all. Absolutely.
And does that mean no side effects?
You might have a little bit of achiness right after the injections, and we'll often tell people to ice, but that usually doesn't last more than a day. And most people do much better with that than the chronic pain that they're having.
When do I start to feel relief?
You can feel it immediately. Usually we get people out of pain when they're on the table. And as how long is that?
It's like that.
Yeah, yes. Now, how long is that going to last? It may last for the rest of the night. It may last for 2 weeks until we see them again. That's why it's a series of injections. But by the time we're done with the third or fourth injection, usually we have cut that pain out.
And you don't have to come back?
Typically not. No, if you re-injure yourself or you're not doing the maintenance things, you got to you need good posture, you need to keep yourself in shape. If you go back to your old habits, you re-injure yourself, yeah, you might be back in here. But if you try to take care of yourself, absolutely.
So what has been the response? We're talking about a lot of different types of pain. What is the response for your patients getting this kind of new treatment?
The majority of people who walk through these doors were able to help. We've had excellent response.
Most of this is covered by insurance. You can always call AZ Pain Centers and they will find out for you. You can check out their website for more information on any of these things that we've just been talking about. It is azpaincenters.com. The phone number is 480-821-PAIN, which is 7246. Again, that website, azpaincenters.com. Or you can check out our special health website at azhealthspot.com. Thank you, doctor. It's always nice to talk to you. And, of course, this is great information for so many people out there. Better Arizona. We'll be right back.